greetings and remarks this evening. Please join me in welcoming Catherine.
Good evening. Thank you, Jamie, very much for that kind introduction. I am first and foremost the Member of Parliament for Ottawa Centre, and I'm really excited about this discussion, and I wouldn't miss it. I'm very, very happy that the Ottawa Hospital is holding these discussions today. I'm very grateful to be able to join my friend and colleague, Yasser Naqvi, and to listen from Dr. Kitts about the hospital's vision for the Civic Campus. So I have a strong relationship with the Civic Campus. All three of my children were born there. And I also paid a visit to the emergency room in a very Ottawa fashion after skating to work on the canal. I had a terrible fall, which was extremely embarrassing, and then ended up with a Civic. I'm sure many of you have the same experience. I certainly know how important the Civic Campus is to the residents of the downtown core and also beyond. Having a hospital close by, easily accessible on public transit, it makes our community healthier and it makes our community stronger. Il est essentiel pour notre communauté d'avoir un hôpital près de chez nous et facilement accessible en transport en commun. The current Civic Campus of the Ottawa Hospital has served our community well for close to 100 years. It is clear that it needs to be modernized to meet the needs of Ottawa's growing population. As a Member of Parliament for Ottawa Centre, I've spoken with a lot of people about, I knocked on a lot of doors to be here. And what I've heard is this is an extremely important issue for people in our community, but also people in all of Eastern Ontario and also in Gatineau. That's why public consultation engagement is a crucial part of this process. This is your hospital, so your voice needs to be heard, and you need the chance to shape the plans for the new Civic Campus. That's why I'm glad to see so many of you have the opportunity to come here to learn more about this exciting vision for the hospital, and also to express your views and what you are looking for from a modernized hospital. You will hear from Dr. Kitts tonight as he highlights the Ottawa Hospital's vision. It will give us a lot to consider, and I'm very excited to listen as well. We've had many good conversations and are working very closely together. Going forward, as Ottawa Centre's representative, I commit to working with my colleagues in the federal, provincial, and municipal governments, as well as the Ottawa Hospital and the community, to make sure downtown Ottawa gets the hospital it deserves. As you may know, the federal government is currently working with the Ottawa Hospital on the location of the modernized Civic Campus that makes sense for the hospital, the government, and the broader community. I know my friend and colleague Yasser Naqvi, who will say a few words in a moment, shares my goal to keep the highest quality healthcare in downtown Ottawa. It's really great to have different levels of government working so closely together. Merci beaucoup. J'écouterai avec grand intérêt ce que l'hôpital a à dire et que les membres de notre communauté partagent avec nous ce soir. Et à l'avenir, je m'engage à continuer à être à l'écoute des résidents d'Ottawa Centre afin de nous assurer les services de santé et de soins que nous méritons. Merci.
Thank you, Catherine, for those words of support, and we look forward to working with you in the months to come. Born at the Civic Hospital, and I'd like to firstly congratulate Yasser. I believe he had a second child born there just 2 weeks ago, so without further ado, I invite Yasser Naqvi, Provincial Member of Parliament, to address the
So if I sound a little rusty, it's because I've been away for the last 2 weeks, because Jamie mentioned my daughter Eliana was born 2 weeks ago at the Civic. So first-hand knowledge of, first of all, what an incredible institution the Ottawa Hospital is in our community. And I think that's something we all should be very, very proud of. The medical staff, the administrative staff, everyone was superb. So Jamie and Jack, through you, a big thank you from my family to the Ottawa Hospital for the arrival of our baby daughter, Eliana. I want to thank the Ottawa Hospital, and I want to thank the entire community that is here in person or have been involved in this very important discussion and will continue to be involved in this very important discussion around the future of the Ottawa Hospital Civic Campus. This is a very important discussion that we are embarking on because this hospital will serve our community for many more decades to come. This is, I mean, imagine this, the current site has been there for almost 100 years. You can imagine how much the new site and what kind of care and services that will provide to our community. And that's why it's important that we have this very important public discussion to ensure that we as a community are working together along with our hospital and the other levels of government together. I do want to acknowledge again our two city councilors, Jeff Leeper and Riley Rockington, who are here because those two wards are very much impacted by the Civic Hospital and they have been quite engaged, so thank you very much for both of you, your engagement. I also want to introduce who is the Chief Executive Officer of the Champlain Local Health Integration Network, in short known as LHIN. Chantal, if you can just please wave. LHIN is a very important provincial organization. Its role is to coordinate health services and sort of spearhead the regional planning around present and future health services in our Champlain region. So they are a very important instrumental part as an agency of the Ministry of Health and Long-Term Care at a local, regional level, working very closely with Ottawa Hospital, that the services that are required today, tomorrow, and decades to come, they're all well coordinated and there is evidence-based planning that's involved. I also wanted to give you quickly a bit of a highlight around a very robust Ministry of Health planning process in order to even approve a new hospital or a redevelopment for a hospital. As you can all imagine, that planning for a major hospital redevelopment project is a complex and collaborative effort that takes multiple years to take place. Each step of the process has mandated public consultation and engagement aspects built into it. This to say that this is not going to be the first and the last consultation. This is the beginning of a very important process where public will be engaged and will be consulted in the entire redevelopment process. As you can imagine, in a planning process like this, there are quite a few common planning challenges that are dealt with in the development of the plans by the health service providers, in this case, the Ottawa Hospital, such as securing a suitable site, conversation we've been having, example, location, the size, and land acquisition cost, which is an important discussion that takes place. Rationalization of services between neighboring health service providers to avoid any duplication and over-planning. Part of the role for Ottawa Hospital and LHIN is to work together to make sure that services are not being duplicated to what's being provided at the general campus or more, even as far as looking at Cornwall or Carleton Place, because you are developing a regional plan, just not a plan for one particular area. And of course, the ability of the health service provider to meet the share of project costs as well. Experience with other major hospital projects, most recently the new Humber River Hospital and the new Oakville Trafalgar Memorial Hospital, identified that planning from concept to occupancy may take up to 10 or more years to complete. This is just to tell you that we are embarking on a very early part of the process. And that's why the conversations we started are very important, because there are many other more steps to come. My commitment to the community, and commitment that I know Catherine McKenna shares, our city councilors share, and I'm confident the hospital shares as well, is that one, we have a future civic campus in the core of the city. That's something I've heard from my constituents, all of us, again and again. We're very lucky and fortunate in our city that our downtown population continues to increase. You can see by all the cranes and the condo towers that are going up. If you look at the demographic analysis today, and that's coming ahead, you will also see that the age is maturing as well. A lot of older adults who are moving into the downtown core. That only tells you that there will be more need for healthcare services in the core in future years. And we need to be very mindful of that as we develop the plans for our future hospital. The second commitment that I have to the community is that we will engage in an open and transparent process. We will make sure that there's community engagement at every stage of the process, that there's a two-way conversation so that we get the hospital right. As I said earlier, this is not just a hospital we're building for today or tomorrow. This is a hospital that is going to serve us for decades to come, and we need to make sure that we all have input in that dialogue. So once again, thank you all for being here. Thank you all for being such engaged members of our community. And I very much look forward, on behalf of the provincial government and most importantly, on behalf of our community in Ottawa Centre, working along with you in the hospital and making sure that we have a 21st century world-class healthcare facility right in the core of our city. Thank you.